Hello and welcome to Are You Ready for the Future? I'm your host, Joe Santana. In this program, we talk with members of the CDO PowerCircle about what they're doing in their DEI practices to address the challenges and opportunities of the new normal and what they're doing to future-proof their practices and their companies. The program aims to provide DEI leaders with ideas, insights, and inspiration from our members who are thought leaders. But before we go to our discussion with our guests in this session, let's first listen to a quick word about our sponsors. I'll see you on the other side. The future. It sounds like we're talking about tomorrow, but the future of DEI is here now. It runs at a relentless fast pace, and tomorrow will be even faster than today. Let's face it, CDOs can't keep up with all of it, especially not applying the same old pre-2019 practices. That's why you need yourself and everyone in your extended DEI team to gear up and get ready to operate like a fast-running, well-oiled machine. And that's why the CDO PowerCircle delivers enriching programs to develop DEI leaders at every level of your organization, from the CDO and Office of DEI members through executive sponsors for your communities to your resource group leaders. We've got you covered. Here are just a few of the benefits your membership buys you. Access to our Sharpen the Axe sessions that give top DEI strategists cutting-edge skills and techniques that they can quickly put to use. Seats for you and all your executive sponsors and all your ERG leads in the ERG Power Talk discussions with today's top thought leaders. Unlimited seats for all the members of your extended DEI team to our Summer Virtual Academy. Monthly exclusive resource letters with timely articles and videos. And seats at the annual DEI Future Foresight Summit, where you get a glimpse at what next year and those that follow will bring, so that you can get ahead of the curve in planning for tomorrow. We also invest part of your membership fee in services that give back to the DEI community while providing you and your company with powerful and significant branding. For example, our weekly newsletter that curates signals from the new normal and the future, our ERG Power Talk podcast that provides hundreds of thousands of dollars worth of free development and insight to ERG leaders across the globe, and our Are You Ready for the Future series, where we provide tips to other DEI leaders to help them get ready for the new normal and future-proof their practices. The CDO PowerCircle, here for you because the future is right now. Our spotlight guest for today is Andres Gonzales. He is Vice President and Chief Diversity Officer at Froedtert and Medical College of Wisconsin. Andres, thank you so much for being with us here today. I really appreciate it.
Thank you so much, Joe, for having me and certainly inviting me to have this dialogue. And I also want to provide a shout out to all of my peeps here. Many of them are from Wisconsin, even though we have also people who have joined us from Florida, like Vanessa. Thank you all for joining us this morning for our conversation.
So Andres, I know a lot of people here know you, but we are recording this and there are some people who are going to be listening to this who may not know you. So tell us a little bit about what Froedtert does.
So Froedtert is a integrated health network. We are owned and operated here in southeastern Wisconsin, and we serve over 8 counties. We have 8 hospitals as part of our integrated health network and over 50 health centers as well. We have actually a workforce of about 15,000 employees. About 2,500 of those are physicians and specialists within our health network. And certainly we are a 2 billion plus operating organization here in southeastern Wisconsin. So a large employer of choice. Actually, we call ourselves an anchoring institution by way of the work that we lead, and actually the work that our office actually leads in terms of creating ultimately greater community and economic vitality in the communities that we serve. So certainly happy to be here, and thank you for having me. And actually wanted to also put a shout out, Joe, for the CDO PowerCircle. So for those of you who are not aware of it, the CDO PowerCircle is a great opportunity to build network with other CDOs, but also to get practical nuggets, right, that you can take back to your organizations, as well as really leverage a lot of the education and insights that you will gain through either speakers that Joe brings and or the ability for us to co-create through our conversation. So certainly look into that at a later time here if you can.
Thank you for that, Andres. And clearly what makes the CDO PowerCircle powerful is people like yourself, the members, and a lot of the great insights that you bring as you're sharing with us today. So, tell us, why is DEI critical to your success at Froedtert? Why is it so important?
We probably can spend the next 8 hours speaking just to that particular question, Joe. It's a really critical question to answer. And I always like to start with a quote, powerful quote, but then B, to give a little bit of history, especially in terms of healthcare and the role that healthcare has played in America. And so the quote, which actually has become my litmus test, my North Star, Luther King. Actually, I revered Dr. Martin Luther King, certainly because of the work that he led, and including, right, giving his life for certainly equitable opportunities in America for Black and Brown individuals. And the quote that really struck me early on is the one that I will actually share with all of you. And actually, I have this quote in my office, which actually, and I'm going to quote him here. It says, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." And I think that if we look historically at the role that healthcare has played, just giving you a little bit of background here, if you look at the Jim Crow era, and I'll point to a particular point in time in 1946, the federal government actually enacted what we know now as the Hill Burton Act. So these were two Congress people that came together to create this, which actually was about, in some way, reformation of healthcare in America. And so really provided a lot of funding to the states to create, right, new facilities to provide care into their community. And actually, if you look at the actual Hilton Burton Act, it actually stated that it needed to be irrespective of the racial makeup, right, of the community. So being agnostic to some degree, even though we understand the structural and systemic racism that already permeated America. So that was really, right, the blind spot in the creation of this act. But certainly I think that there was some good intent behind it. But the impact, right, at the state level was that then our states then decided to actually just take that money and create facilities that became racially specific and inequitable, right, to our communities at large. So this really then created what we know as the colored hospitals, and then obviously hospitals for white people. And so depending on which, obviously the color of your skin, you were actually only allowed to go to certain facilities. And we know certainly the impact of that and the legacy of that. So certainly when you went into those hospitals that only served colored people, as they call them, these were actually poorly staffed, didn't have the right equipment, didn't have all the resources that it needed to critically treat the communities that it served. And so it created, obviously, inequities in America. And so we know also of the Tuskegee experiment and so on and so forth. And so my point here is we need to actually understand that healthcare has played a role, that government has played a role. I think for us, it really has become really important. And actually, I give kudos to our CEO, Kathy Jacobson, who actually provided the forward letter for Joe's book, but also got quoted several times in the book, because Kathy ultimately has been a transformational leader, a very bold and courageous leader in terms of how she leads at Froedtert. And I think that the first piece for us has been acknowledging the role not only of healthcare systems in America, but our own role within the southeastern Wisconsin, right? Understanding that we have left historically some communities behind, and those happens to be diverse communities. but that moving forward, we're going to actually be confronting that, right, by co-creating opportunities where we're going to be inviting our diverse communities to the table to have these discussions. And so I think the great example of why DEI is so to our success, I think, right, came about 2 years ago with the COVID-19 pandemic, where not only we had to actually quickly pivot and shift into a new reality to address the impact of COVID in our communities. And actually, in our case, our BRGs were actually in the forefront of that, because our BRGs were actually involved in the co-creation of an effort that really changed vaccine hesitancy into vaccine confidence, in not only internally for our own staff, but also in terms of addressing the needs of our communities at large. And actually, out of those discussions, community conversations, as we call them, a number of community members said to us, hey, what about if you guys create, right? If we co-create together public service announcements that are both culturally and linguistically relevant to the communities that we serve. And part of that has to be that it cannot be done by physicians or leaders from the healthcare system. Really allow us, right? Empower one of us who's a trusted advisor of our communities and representative of our community to be that spokesperson. So we heard that, we worked with them, we were able to create those service announcements in about, honestly, a week time frame. We were able to roll that out, and that was actually a great way of really starting to educate the community around how to protect themselves, how to, honestly observe social distance, obviously wash their hands, wear masks, but also, as obviously then we had vaccines here, the importance of getting vaccinated, but also understanding historically also the issue with vaccinations in diverse communities, and again, and the role that healthcare has played. So that was actually one of the things that we did to do that. Number two, it was around also addressing the economic impact that it created. So we know that there's a ton of social determinants of health, things like transportation and food insecurity, people losing their jobs, right, during the pandemic, that we needed to address. And what I love about our strategies at Froedtert is that we did not stay on the sidelines. We decided to be proactive in our approach. We responded swiftly and effectively, again, because of the community conversations, the partnerships that we have already strengthened in the community, to really leverage our community partners who are the trusted, right, advisors and or organizations in the community. And really through them and with, we were able to actually create opportunities by which we were either able to conduct either job fairs, provide health screenings, provide food to the community at large. And so those were ways in which we showed up during early in the pandemic, and we continue to actually double down on those efforts. So that was the other big component there that we were able to actually activate. And then the third one, of course, and I think we all certainly, I think it was not something that was created, but more really exposed the realities, was the community and social unrest that happened, not only with the death of George Floyd, that was probably the tipping point, but a number of other deaths. And I would actually argue that in Milwaukee, our watershed moment happened in 2016 with the death of Seville Smith. And I know I have a good group of individuals here that understand those realities. You remember back then, and that became the 3-day unrest that now we know as the Sherman Park unrest. And again, we had 300 staff members that were impacted by that. Actually, I had one of my own leaders who lived in that community that was impacted by that unrest, because unfortunately there was some looting, some burning in the community. And that was really what was portrayed nationally at that time. And so for us, it was more about, again, acknowledging that, hey, we have a role to play as an anchoring institution. And so that really set our commitment to become an anti-racist healthcare system, so much so that we have actually taken a pledge where we actually called out racism as being a health crisis impacting the communities that we serve. But not only did we actually do that and we took that position, we actually committed to 4 key actions. Number 1, treating people with dignity and respect. Number 2, examining our own biases and reducing our biases to make healthcare fair and equitable for every single patient that comes through the doors, measuring, tracking, and reviewing all of our policies and our practices to meet the needs of everyone we serve, and ultimately leading change in our communities by addressing healthcare disparities. So again, we have actually done that. As of late, we ended up actually putting that banners that if you go to any one of our facilities, you see that banner in the walls there as you enter. And that was actually our way of saying, hey, we want you to know what we stand for and against, but we also want you to hold us accountable, right? Whether you're staff, whether you're a patient, whether you're a community member. And I think that really has become catalytic to our strategies and to the efforts that we certainly are driving at Froedtert and the Medical College of Wisconsin.
That's wonderful stuff, Andres. And I have met quite a few times with Kathy, and you guys are in perfect sync in terms of the things that you talk about, which is really great. One of the things that we talked about also way back during the time when we had our Future Foresight meeting, and you were one of the ones who was leading one of the panels. One of the discussions that we had was about some of the changes that had happened already. We had entered that new normal, and we talked about what opportunities and challenges this raised for you and others that were there. Talk a little bit about that in terms of what are some of the opportunities and some of the challenges that the new normal has brought. So we're post-COVID now, we're in the vaccine era, but we're not where we were before. We're not going back there. What are some of the things that are happening now? And how have you and your team at Froedtert been able to address those opportunities as well as address some of those obstacles that have shown up?
Great question, Joe. I will start by saying that I think that we had to actually go through a whole mind shift, right? It really required that. And so the first comment that I'll make here is one of the first things that we did, and remember Kathy early on as our CEO, galvanizing our leadership team virtually to have this discussion, because we moved actually our corporate folks into remote work within a week's time frame, which was actually, it was actually a strategy that we had under our extraordinary people, our people strategy, probably 10 years down the line. So we had to accelerate that. And so my point here is we had to actually understand that disruption was here and that we either become proactive about embracing disruption and really maybe even being disrupted ourselves, right, in our own healthcare system, or else we can actually stay on the sidelines. And then obviously we can certainly are going to probably create a mindset of being victimized by these realities. And so for us, it was more about being proactive and really addressing this in a manner that it made sense, not only for us as a great workplace of choice, but also as a healthcare of choice in our community. So the first one was we needed to actually shift our mindset around what disruption really meant and really embracing disruption moving forward. So that's the first key learning there for us. Number two, to that point, so as we move people and we understood that now technology is going to play a greater role. And I think it's one of the things that you capture in the book so eloquently, Joe. For those of you who are here, maybe some of you have heard this story or not. The day that we actually went virtual, completely virtual for all of our engagements, we had our Women in Leadership BRG. That was the day that our group was actually launching its first event, its first effort. And so I remember our former Director of Diversity and Inclusion at that time, who actually Joe knows, Sherry Trent. Sherry actually ended up actually sending me an IM message through WebEx and said, hey, can we chat? I saw the note from our Chief Medical Officer saying that all of our in-person meetings now are shifting into virtual meetings. How do we do this? So luckily we had technology. We're able, again, to embrace technology. We're able to do that. And here's the beauty of this, right? The silver lining. By doing that, we were actually thinking we're going to have about upwards of about 120 people in that particular conference room, because that's what that room, right, would have afforded us to actually, in terms of numbers, to have there pre-COVID. And now we were able to actually provide through this platform the ability for people to actually join from their facility, right, from their comfort of their home or their actually computer, their desk. And so we had actually upwards of about 400 people that actually joined that particular event. We still, of course, had our panelists in the room. So it was somewhat of a hybrid strategy, but we're able to actually provide that to a broader group of individuals. And we started learning that virtual or remote work does not have to equate to isolation either, right? So it's about how do our BRGs then galvanize and become really great conduits of creating a greater, not only employee network, but also providing meaningful opportunity, right? And providing ultimately that sense of belonging. And so we were able to do that. So that event was actually not only provided to a much larger, broader audience, B, it was recorded. So for those, as you were talking about it earlier, Joe, to your reference, right, you might have people working different shifts or actually working remotely, right? It's a multidimensional workplace. Now we actually have an offering for everyone within the health network, right? So now we're becoming, again, really thinking through on how do we become equitable in our practices moving forward. And then ultimately, this actually then provided an opportunity for the BRG to really reach out and really connect, right? A much broader audience within the health network. And now we have actually been able to actually other efforts in the community, which now are actually where we're reaping actually the benefits of that through actually efforts that actually Dessa Jensen, who's here with us, leads through our emerging markets. And we're seeing that we continue to be the market share generators or winners in that particular effort. So I think that those were some of the key things that we learned or opportunities that actually lie in front of us. And so I would say that's actually some of the things that you want to actually think about. I think the other pieces for us has been around artificial intelligence. How do we actually understand what are the algorithmic biases that exist, right? In terms of some of these applications or technologies that we're using. For us early on, being very truthful here in this group, we had to launch right a care platform within 72 hours to continue to serve our patients, those right that we wanted to make sure that we were keeping outside of our four walls that didn't need to be there and exposed to COVID, of course, because we went into this COVID mode, as some of you had to also enact right away. And so for us, it was around then, if we're going to actually do that, how do then we provide equitable care to every single patient in every single encounter? And so for us, it was around working with our language services team and our chief innovation officer. So as we ramped up on providing those offerings, virtual care offerings, how do we actually ensure that we had the right language capabilities for our limited English proficient or deaf patients? And really understanding also that this also created a digital divide. So how do we ensure that then those patients that live in some of those communities that have been left behind might have the right technology to connect virtually to their provider? So we're able to invest in some of those strategies through some of our other partnerships in the community. So again, I would say that those are actually ways in which we actually did that. I think the last opportunity that we have in front of us now is ESG. As we all know it, right? And now every single organization is looking at around what's in it for us from an environmental, social, government, or governance standpoint. ESG is becoming now a key differentiator for all of us. And I think EDI is actually a thread for all three of those key efforts that are underway. So again, having a seat at the table so we can have meaningful discussions around what it means for us at Froedtert. And so we already have had those discussions. We're actually building our holistic strategy around ESG to ensure, again, that we are being good stewards and certainly, again, being an anchor institution in our community. I think in terms of threats, disruption will continue to be an issue. In the last 2 years, it has been COVID, but let's face it, it could be tomorrow, unfortunately, a hacker that comes in, right, and tries to hijack your systems. So I think it's really the way of our new realities and part of the new frontier. And so I think for us is how do you stay mindful of those things? How you continue to be innovative in your approach and forecasting those things, and certainly ideating with your team and others for that matter. Right? So that really then speaks to becoming a trusted advisor of your CEO and other senior leaders to ensure that you're actually working with them and guiding them through those discussions and processes. So ultimately you ensure that your tactics obviously are equitable at the end of the day.
Absolutely. What are some of the steps you started going toward some of the things that you see in terms of disruption and more disruption coming? So what steps are you and Froedtert taking to future-proof your company via your DEI practices? What are some of the things that you're doing? Because maybe that opportunity or threat is not here, but you see it looming in the horizon and coming in your direction, so that you obviously need to take some kind of steps. What are those steps?
So I will start first and foremost, as I was mentioning earlier, for us, again, because we have actually built a holistic strategy around not only equity, diversity, and inclusion, but also anti-racism, was the acknowledgement that racism is well and alive, is thriving in our healthcare system, right? So the first step that we have taken, actually, and again, kudos to our Diversity Council that is chaired by Kathy Jacobson, our CEO. We had an honest discussion there. And one of the key efforts that we are now, that it's actually underway at Froedtert, is we are dismantling racism. The way that we're doing that is that we have decided to actually start internally focused, right? Inwardly focused. So we're actually want to get our house in order. So what we're doing there is actually looking at our entire ecosystem internally to really understand and map out every single policy, process, and practice that we have, and really challenge that to understand where's the barriers, where do the barriers exist, or does actually the racism exist there, so we can dismantle that and then create equitable policies, processes, and practices moving forward. So that's actually one of the first things that we're doing. So that requires getting your CEO buy-in and support. Number two, working with senior leaders. So actually one of the things that we have done, and actually, again, kudos here to my team, because everyone here in our team has become a trusted advisor in their own respect. We're working with senior leaders, and not only those who actually serve as executive sponsors to our BRGs, but actually across the board, working with all of our leaders, right? To make sure that we're coaching them, that we're guiding them, that we actually are helping them to connect those dots, and ultimately for them really to understand what's the EDI elements embedded right in their own swim lanes. So then they're able to exercise those muscles, EDI muscles, moving forward. So that's one of the things that we have done. Number two, equipping also our BRG and executive sponsors, right? So I think you spoke to this earlier, Joe. It's our ability to also continue to build ambassadors, right? So I think one of the pieces there, it's about, again, equipping your BRGs and your executive sponsors. And so that's actually a lot of the work that we're also doing at Froedtert. So really working with all of our BRGs. And part of that formula is really, how do you turn your BRGs to become culture ambassadors and guardians of your culture at the same time? And so I have to say that has been also the transformation that we have gone through. And again, our team in partnership with our BRG leaders and their executive sponsors are leading the way around those efforts. And then I think it's also understanding, how do we think strategically and intentionally about the efforts that we have underway? And again, we have been fortunate enough that I and our team sits at the table with our strategic planning team. So when we're actually looking at ideating what the goals and the objectives and the tactics will be for either this year or, more importantly, for the future year, we actually are certainly infusing, right? What's the equity, diversity, and inclusion elements of those efforts? And then ultimately also, what's going to be the metrics that will also constitute success, right, or collective impact. And so that's the other piece that we have done as well. And so we have a balanced scorecard in place that we now are able, to delineate and where we have demonstrated the return of investment for our equity, diversity, inclusion, and anti-racism efforts. So those are some of the things that we have done here and things that we're doing in terms of future proof. So a lot of this is about the mechanism and really looking at being intentional around hardwiring a lot of this as part of your practices moving forward, right? So it's going to be the way in which we're going to think, it's going to be the way in which we're going to be behaving and acting, right, as an organization moving forward, whether it's actually on the people strategy side or whether we're talking about kind of the workplace or community side, externally facing side for our consumers or the communities at large. And so I think that those are some of the things that we have done in terms of looking at future proofing, that we have a lot of those mechanisms in place to really ensure that we have the guardrails, at least, and ways in which we're engaging our leaders to think through those lenses. So hopefully we can continue to actually build and maybe amplify on that foundation.
So here's my other question. What's the most important piece of advice that you have for participants who want to future-proof their organization through their DEI practices?
That's a great question. So I will say, be strategic and intentional, as I shared. I think one of the things that our team has learned, especially over the last 2 years, is that less is more. Rather than doing 20 things and maybe doing things that traditionally you were doing, that were probably more categorized under the fun, food, and flags, especially for the BRGs, being intentional and strategic, right? What are the one or two things that the BRGs can do, right? Where they're going to actually affect the change, where they're going to actually add the greatest value. So I think being strategic, being intentional, embedding those EDI elements into your whole strategic plan, right? And ensuring that your ecosystem, right, is thinking through those lenses so you can continue to be equitable and certainly just in the way in which you are either recruiting, developing, promoting your staff, and the delivery of care in our case on the other side really has become important. And so I would say that those are some of the key learnings or nuggets that I would offer that we have learned over the last few years.
Andres, thank you for that. I really appreciate it. And thank you for joining us for this session of Are You Ready for the Future?
Thank you, Joe, for having me here today.
Thank you for watching this video. Please subscribe so that you can watch all of the discussions with our insightful guests. Again, I'm your host, Joe Santana. Thank you for tuning in.